The one thing about mental health is that one needs to have a holistic approach to the treatment of mental health. You can't simply focus on medication. You say somebody is depressed, therefore we simply give them antidepressants. And the other thing that we found in our work is a lot of our people are uncomfortable with medication for depression. You know, Africans are very skeptical when it comes to taking antidepressants. So for mild to moderate depression, I wouldn't rush to prescribe medication. The talk therapy, provided it's structured and it's evidence-based, can be extremely powerful and can produce the same results, if not better, than just giving medication. In fact, our clinical trial, which is published in the Journal of the American Medical Association, shows that talk therapy was much better, even after 6 months, was much better than an antidepressant, such as Prozac. So I think there's hope. There's hope that we can do a lot without using medication. But the whole concept of institutionalization, often encourages the use of medication. And this is why, as Africans, as a continent, we need to move away from institutionalization, but focus more on integration. How do we take mental health to the community and integrate it into existing programs, such as the HIV program at primary healthcare level, maternal and child healthcare program at primary healthcare level. That way we really look at mental health as part of a holistic system. This is the way we want to go, and this is what the African Mental Health Research Initiative is trying to achieve. But before we can achieve all of that, we need to understand the epidemiology of these conditions. For instance, what kind of people are more likely to have these problems and why? What is likely to work in our setting? Once we understand that and we understand how to identify those with problems, we then come up with these interventions which we can scale up at community level. So what we are hoping is, the Friendship Bench, which is in Zimbabwe, is just one of many different interventions that will be developed and scaled up in Africa in the next coming years. The training is specifically focused on what we call problem-solving therapy. But attached to that, they are taught skills which are related to some aspects of cognitive behavioral therapy, such as behavior activation, or activity scheduling. So these lay health workers who sit on the bench, they are trained first and foremost to use a screening tool which is validated, in the local setting, and translated in the local language so everyone is comfortable with it. And so using this tool, they are able to tell who really needs help, and they can also tell which particular clients need to be referred. For instance, if someone comes to the bench and they are highly suicidal, that is a red flag. The lay health worker sitting on the bench, or the grandmother, because most of them are actually grandmothers, they would then refer to the next level. But it's only a small proportion that needs immediate referral. And with time, we find that these grandmothers become extremely efficient in delivering this evidence-based intervention, which, ironically, when we started, we were told was something that could not be done by uneducated people. And these are grandmothers who have on average 10 years of education, some of them less. So what we're showing here is that it's possible to train ordinary people to deliver a complex intervention. So after the screening, you then have the actual intervention. And the intervention consists of 3 key components, which involve what we call opening the mind, okuvura pfungwa, that then leads to kusimudzira, which literally means to uplift, and then to strengthen, which is kusimbisa. Those are the three components that our grandmothers work with. And it's a very simple approach, but quite powerful in terms of empowering the person who is presenting with symptoms of depression or symptoms of post-traumatic stress disorder, you name it. Mental health is a significant component of our existence, and so I learn from my clients, and because I learn from my clients, I become a better person. So I find it extremely humbling to be able to interact with people who come to me with different problems. I learn from them in the process of helping them. That's why it's really important for me. And secondly, it's important for me because it gives me the opportunity to actually ask questions and then go out in the community and find answers through the research that we're doing. Through the African Mental Health Research Initiative, we ask questions. Why are we seeing this? Why are we seeing so much substance abuse? Why are so many young people abusing cough syrups, in Zimbabwe? What is happening? Why is this linked to the poverty? Is this the political, social, structure that is affecting all of this? We go into the community, we look for the answers. And when we found the answers, it's not just about making noise that this is what we found, but it's primarily about coming up with solutions. And the only way you can come up with solutions in Africa right now is to really empower communities by empowering ordinary people at community level. And this is what we seek to do with the Friendship Bench, and this is what we are also seeking to do through the African Mental Health Research Initiative.